And to offer the DFL perspective on healthcare policy is the ranking minority member of the Health and Human Services Finance and Policy Committee, Senator Tony Lourey. Welcome.
Thank you for having me.
Not long ago, I heard Senator Bach talk about how Health and Human Services became aware of some of the problems that we're facing now, particularly in the individual insurance market last year. What kinds of reforms could have been done then, if it had been possible, to address the withdrawal of insurance companies, the narrowing of networks, and the skyrocketing premiums?
Yeah, you know, this is an issue that we have been working on for quite some time. And, you know, in the interim ahead of last session, we pulled the A-team of the healthcare community. Hospitals, doctors, clinics, consumer advocates, mental health advocates, legislators from both sides of the aisle, health carriers, 29 members together, and spent hundreds of hours in the healthcare financing task force. And in the Senate, we carried almost, I think, every one of the recommendations that came out of that task force with 80% support into conference committee, where each and every one of them, you know, failed. You know, some of the things that we did try last year, the tax credits for people that aren't eligible for the advanced premium tax credits available through the feds to help subsidize. This is something that we recognized and introduced right at the beginning of last session and weren't able to get traction on. I think that one is very similar to what we're talking about now and works with the federal construct to try to move us forward and help make sure that, again, we have access to affordable and quality health care for each and every Minnesotan is what we continue to try to get it back to. Another really critical reform that I think we were working on very hard and we should continue to look at is, you know, as the individual market, that private model begins to unravel, particularly in greater Minnesota, we should be looking at trying to make Minnesota Care available to consumers out in particularly greater Minnesota, where some of the access issues and some of the rate increases are the steepest.
Well, let's talk for a moment about Senate File 1. House File 1 is moving through the House. Senate File 1 is now moving through the Senate. This legislation would provide emergency premium relief, among other things. Hearings have started. What are your thoughts on this particular legislation? So,
I mean, I think there was 2 articles of the bill, and it's that, amongst other things, is where we're having some issues. You know, I think that you know, the governor and the DFL Senate have been for 2.5 months now saying we need to do that immediate premium relief. We tried to do it during a special session. That was, you know, it didn't come about for a host of reasons. That premium relief is something that we could do even yet today, if we had the will to get it out of the chamber clean and make sure that we have a 2017 marketplace that has that additional stability so that we can then begin to talk about what the 2018 market and beyond looks like. It is certainly the case that we need some market stability measures, and we should act with all due diligence on those, but those are issues that need a bit more vetting, need a little bit more work, a little bit more transparency, some time to actually get the fiscal notes and have some assumptions around how they function. And those are things that the answers to which we just don't have today. And so there's this whole set of really significant changes to the entire fabric of what healthcare in Minnesota looks like that just don't have any of these assumptions borne out.
So your preference is still to do the premium relief as standalone, and then really work hard on these other reform areas.
Right.
What types of reform, more specifically, would you like to see? If you could have it done the way that you wanted, how would you reform the narrowing of the networks and the continuity of care? Yeah,
well, I mean, I honestly do think that looking to our public programs and how they function, you know, honestly, in the metro area, there is great competition amongst providers, amongst carriers, and you know, their individual market is much less volatile than in greater Minnesota. That's where most of this, particularly with the networks, I mean, because you have very few providers out there, and if you cut out 1 or 2 providers, I mean, you're really disrupting a lot of care for people. I think that making Minnesota Care as an option, at least in areas where there is lack of competition or where there are premium spikes that rise to a certain level. I mean, I'm willing to offer it statewide, but make that public program offering available on a much broader scale could bring an additional choice to consumers and some additional competition for our private sector actors.
I've heard the Republicans say that for these greater Minnesota areas where there's a lack of competition, one way to increase that would be to bring in for-profit HMOs and some cross-state insurance company type things. What is the rationale for being opposed to that, if you are opposed?
Well, we certainly can have some meaningful discussions about what that would look like. And within the context of the consumer protections embedded in the Affordable Care Act, guaranteed issue, kids to age 26, things that are really widely valued across the population that are in question. If we allow for multi-state actors, the typical trajectory of that is to offer very skinny plans, particularly.
So it's essentially catastrophic care?
Well,
is that what
yes,
you mean?
And it would peel the healthy populations out of an already unstable market, actually creating even steeper premium increases for those left in that market that need a broader set of coverage options for age or health status, something like that. Those are some of the concerns. Within the context of the consumer protections that exist today, maybe it's not that big a deal, but are we going to put those consumer protections in some way in an environment of such uncertainty at the federal level? I am a bit reluctant to just say, well, whatever the floor is at the federal level, any actor in a state that has a much different insurance marketplace than Minnesota, that what they're able to put together would be good for Minnesotans. Minnesota, what needs to be kept in mind always is that we have achieved 96% coverage in Minnesota. That's the lowest uninsured rate we've ever had, and we are consistently in the top 5 for the healthiest states in the country. That's not by accident, it's by design. And some of these issues that we have embedded in the fabric of our healthcare system, at least need to be discussed a great deal more and understood a great deal more than one day of 6 hearings across the House and the Senate provides the healthcare community, consumers, legislators, the ability to weigh in and understand what it is we're doing and make good and rational choices to provide the stability that we all agree we need to work on.
Senator Lourey, I want to thank you so much for your time today.
Absolutely. Well, thank you for having me.